The pattern since the 1980s to the present has shown consistency, with the annual figure averaging 21,000 per annum. This allowed the migration valve to continue to reduce unemployment pressure, without which the economy would very likely erupt. Easing population pressure to reduce unemployment has become an inescapable standing policy of all Jamaican governments. As both social and economic policy turn on the hub of unemployment, new policies would have to be devised from time to time to achieve low unemployment rates. The first policy prescription to meet this challenge of population pressure was the introduction of family planning. The need became particularly apparent in 1963, and work was set in motion to develop a project. Prior to this, a small family planning project was already operating for some time on a private basis, led by pioneers Dr. and Mrs. Leonard Jacobs. The World Bank was approached by Health Minister Dr. Ellie Meyer of the Jamaica Labour Party government, who took the initiative. However, there was a major problem. At that time, the World Bank did not deal anywhere with social problems as a matter of course. It was only beginning to address social concerns. The bank, in fact, was at that time breaking new ground on a far-reaching education reform program dealing with secondary education system in Jamaica. This was its first venture into education. It would be a huge policy shift to convince the bank to expand the framework further to accommodate a program dealing with another social issue. To overcome this obstacle, the bank was asked to recognize the impact of overpopulation on chronic unemployment, lack of school places, shortage of trained teachers, inadequate housing, and increased malnutrition. All of these problems would require budgetary resources, which of course would be of particular concern to the bank. These debilitating factors led the World Bank to recognize the seriousness of population pressure. Eventually, there was an agreement to finance a family planning project for Jamaica, the first ever by the World Bank anywhere. External financing was not the only obstacle. There was a full obstacle course to be faced based on social, cultural, and political objections, some of deep historical significance socially. Family planning carried a nuanced emphasis which allowed black nationalists and some political propagandists to twist the message to a claim that it was a plan to kill black people. The strong emotional overtones proved difficult to overcome, since success depending on attracting fullest possible participation, and many of the potential participants would be discouraged by the propaganda. Over the first few years, support grew slowly on a net basis, as there were many eager participants, but eventually also many fallouts. Culturally, there was strong objection by males to the use of condoms. This required changing the cultural perspective on reproduction. Generally, in lower income households, children are seen as insurance for parents, a source of assistance to their old age. This led to above average and large families. Young women believed that there was a need to mother a child early to avoid the ridicule of peers that they were mules, which denoted being barren. Others believed that women were destined to have a predetermined number of children based on the amount of bumps or knots on the umbilical cord. If this amount was not fulfilled, sickness would follow. But the greatest impact on childbearing was another cultural belief. ingrained in males historically from the slave society experience, that the breeding of children was a positive sign of manhood. The origin, of course, was the encouragement slave masters gave to male slaves to increase their numbers by promiscuous breeding, a practice of slave masters themselves with female slaves, especially after 1807, when the slave trade was discontinued by an enactment in the British Parliament prohibiting transatlantic slave trade.